Hello to everybody. Yes, I'm Per Simonsson and work for startup Hestia Agora. And as you know, this is Greek. Hestia is the home, and Agora is the business area around it. And they meet more and more at home for the elderly. But we are working with prevention of ill health, preventive measures. And for Digit Pre, we want to test the measurement of elderly quality of life and analysis of the best preventive measures to retain or increase that quality of life. Now, this is a way to measure quality of life that is perceived among elderly before they enter the healthcare system. Sorry, I should take the next one here. So declining health among elderly, for example, malnutrition, falls, mental illness, develop over time and at increasing speed. You have a lot of decrease in quality of life for these things, for example, malnutrition, and it costs a lot for society to provide the health care for it. So better to prevent this. But how? It's difficult to identify and prevent declining health among elderly in time because there are no systems that can do that. So we tend to take care of them after, for example, a fall have occurred. So our solution gives an elderly an early identification and information about what preventive measure that will have the best effect for them. So we're working with a tool that consists of two things. There's an app that the elderly can use, and there's a web app that caregivers, like for example, municipality or regional health providers can use. But for the elderly, we have this app, and you can, in that app, have a very easy, user-friendly way to see how your quality of life is. And we're working together with scientific validated surveys that measure the quality of life, for example, ASCOT, or IceCap or EQ5D, where then the elderly can do this survey and see what kind of issues they have and how they could prevent that issues to become illness. This is connected to a web app that public or private care providers can use in order to prepare for elderly that have issues with health, so they can put in preventive measures or prepare preventive measures. They can also analyze what kind of preventive measures would be best for the elderly when they enter elderly healthcare. So the thought here is that the caregivers will have a lot of very valuable data about elderly, and that is where we would like to get paid from the care providers, but the users are the elderly themselves. So what this project we are thinking about is to test this system with elderly, preferable in different countries, develop user-friendly products, attractive for elderly. We have already the app, so it should be tested, and then we can do some alteration so it be more user-friendly. We have tested it in Sweden, but we also need to have input from other countries and put the product on the market in at least 2 countries. So we're looking for partners that either can work with measurement, user-friendliness focus groups, or partners that have a product within health tech or med tech where our product can measure quality of life. For example, to be a part of Palo's platform system, this could be one application for that one to measure quality of life. Mm-hmm. That's it for me. If you are interested, please just contact me. And here is and we are, of course, at the Digit Pre platform, matchmaking platform as well. Thank you.
Thank you so much, Per. Any questions from the audience? Okay, Kimo. Interesting solution, he says, and will need it. What is the business model? Who would potentially be the payer?
Yes, we figure out that the business model would be that the caregivers, for example, public or private caregivers in elderly healthcare, pay for the data. And that is, the data is valuable for them. The elderly that use this, of course, they need to find it attractive to use it, but it's a product that I think it's hard to get paid directly from the elderly themselves. So that would be the business model as we thought of now.
Okay. Thank you so much, Per. Wave Up is asking, is this a medical device or considered as a medical device, and in potential need to be CE marked?
It's not really a medical device because it's just that you measure the perceived quality of life among elderly with help of the scientific proved surveys. So I would not say it's a medical device. I don't think so, because it's not really measure medical, for example, like blood pressure or something like that.
Okay. Okay. Thank you, Per. Isabel asks, which domains of life are covered in your questionnaires?
Yes, depending on what survey you use. We have worked with ASCOT, and it covers 8 different domains. For example, the feeling of safety, if your home are clean and comfortable, if you have a social life, if you have occupation, what do you think about the care you are given, if you have access to food and drink that you like, if you feel lonely, if you have a social network.
Fantastic, Per. Quick question, actually, from me. I assume that if you are putting the EQ5D questionnaire, you can calculate QALY.
Yes, and you can calculate QALY with the IceCap and ASCOT
with the IceCap
well.
too, exactly.
Yes, it's QALYs that you calculate, and that data is important for the health provider.
Absolutely. Absolutely. Thank you so much. Vendelin asks, can you give an example of how you would cooperate with a company that measures the prevention of falls among elderly people?
Yes, then we can take the holistic part of that, because a fall can, the reason for a fall could be many. For example, it can depend on malnutrition, it can depend on declining muscles, depending on that you're not moving a lot. It can depend on your social situation, actually. If you are feeling very lonely, then you're not going out, you're not doing anything, you're not eating, and that goes towards a fall. So what we could do for a fall prevention is to see the holistic part where you can add different preventive measures in an early stage, and we can also see how the fall prevention that are provided by the other company would affect the perceived quality of life among the elderly person.
Fantastic. Thank you, Per. One last question, and quite interesting. Any approach on pain intensity or pain localization in types of questionnaires?
Yes, we have in the EQ5D, that's a survey that are used a lot in Sweden. There you have there you have questions about pain included in the quality of life, and it's actually one of the highest ranked. It is the highest ranked question, so it's a very clear indicator. It's not that much in ASCOT or in IceCap if you're using those systems for pain. So that depends on what kind of system you use, or survey. You can use any survey in our system. Yeah.
Any survey. Okay.
Yeah.
Well, thank you so much, Per.